This might be a controversial take, but I don't think immediately putting all of your medical record and test results on a MyChart without any context is very helpful. If you take my blood at the end of any shift I work where I'm probably not eating or drinking or peeing for very long periods of time, my electrolytes are probably a little messed up. Like if you drew them, a lot of the numbers would be red, but I'm a doctor, so I know what's significant and what isn't. Can you imagine if you were getting antibody testings like anti-nuclear antibody testing, and it's positive, but it's not a specific test, or your CEA levels or your PSA levels for cancer screening, and then you're just given a number without any context or any training to know what to do with that medical information? Or if you were tested for diabetes and your A1C is 8, and surprise, you're a diabetic now, but you have no idea what to do with that medication. You don't know if you're going to go on insulin or oral medications or whatever. You're immediately allowing a patient to spiral or to look up things that they're not qualified to do on their own. Now, on the other hand of this, I don't like it the other way either. Like, you shouldn't have all these results and not know what to do with it for days and days at a time and leave them in limbo. That's not fair for patients either. Maybe a solution would to meet somewhere in the middle, right? Like give a 12 to 24 hour buffer for the provider to look at the results, reach out to the patient, inform them of the results, and then provide that to them. So that way you're informed of the management of something and not just given a bunch of numbers that you don't know what to do with. This often happens in things like pediatrics, where they'll get like a chem as an outpatient, and a parent for their 3-year-old will see that their potassium was 3.4, and they see low potassium, and they Google that, and they see things about arrhythmias that can happen, and then they Google arrhythmias, and then they're like, oh my God, is my 3-year-old going to have a heart problem? And all of these things could have been avoided by just allowing the provider who ordered the test to inform them of the results. So in a way, it's a lose-lose for both parties. But I think it's naive to say that just blindly giving a bunch of people without medical training, or even with medical training, a bunch of information that they have no tools to actually do something about, I don't think that helps people as much as they initially thought.